Marissa McCarter. I'm the Community Resource Assistant at the Idaho Division of Veteran Services, also known as Mini Mitzi. Mitzi's actually in Washington, D.C. today, a part of that Governor's Challenge again. I think we're taking turns because last month I was in D.C. and now she is. So I'll be subbing in for her. We've got a full schedule of speakers from all different areas of the VA as well as the Boise Vet Center. So it's going to be a lot of really good information today. Good morning, Christina. Good morning, David.
Good morning. Can you hear me?
I can.
All right.
And we've got a few minutes if you want to talk about any updates from Idaho Veterans Guide. Now would be a good time. If you're ready.
I can do that. Do you have any graphic available there?
I'm gonna try. We had to break down our stuff yesterday for a presentation, but I think I got it set up. It might fight me on it. So do you want to go ahead and just kind of give us a quick update?
Sure. So we're happy to see that the guide is being used quite a bit. I think we had about 3,300 searches through the end of April, which is really significant. We added about 150 organizations, and over 100 more claimed their organizations on the guide. Anecdotally, I've heard from many people that that veterans are using the site and that they're benefiting from it. They're linking up to services, and it's creating some real value for folks in their lives. So we just appreciate everybody's support of the Veterans Guide and hope that you'll continue to spread the word. One of the things that will happen after this meeting today is we'll send out our report from January through the end of April, and you'll be able to see the stats that I've just quoted. And we're also sending out some artwork for you to be able to take this, and I'm going to just put it up by the camera. Can you see that? Kind of business card size artwork so that you can send that out to your printer and get 1,000 or more cards and just send them out to everybody. Rather than us trying to print cards and get them out to you, we thought we will just develop the artwork in a business card format, which is really cheap to reproduce, send it out, and have them printed by your organization and just get them out everywhere as you talk to people, hand them out, and it'll make a difference. So that artwork will be coming out with the report for January to April. And just keep promoting it. We appreciate you doing it, and it's making a difference.
Awesome. Thank you. Yeah, I was excited when I saw that report too, because gosh, what was at the top? We knew we were getting to veterans when people were searching for benefits.
Yep.
So
Yep.
there was a lot of good connections. Over 1,000 interactions, meaning people are connecting to those organizations that they're finding through Idaho Veterans Guide. So that's great things.
Yeah, interestingly, the top 3 categories that searches are being conducted for are benefits is probably the lead category right now, and then food and housing. So food continues to be a big concern by a lot of people. We're seeing that in our organization, where a lot of people keep coming to us with needs, very, very basic survival needs. and that's not over yet. We need to do more in that area. Um, so keep plugging away.
Awesome. Thank you so much. Good morning, Mark.
Good morning.
We'll get started here in just a few minutes. But again, for those of you who have just logged on, I'm Marissa McCarter. I'm the Community Resource Assistant at the Idaho Division of Veteran Services. And some of you know me as Mini Mitzi, which I am subbing in for today. She is in Washington, D.C. With the Governor's Challenge once again. But we have a great presentation today. A lot of information from the VA and the Boise Vet Center. So I'm excited for this one. So just to get us started, we'll start here in about 2 minutes. I'm waiting for a few of my presenters to get logged on, and then we'll get going. Good morning. All right, so we're just 1 minute out. So I just wanted to let everybody know we do have a very full schedule today. Let's see, the VA Medical Center, the regional office, behavioral health, Boise Vet Center, outpatient recreation, suicide prevention, and women veterans programs. So we have a lot. So I'm going to go ahead and introduce everybody to Mark and just see if he has any updates from IDVS before we introduce that first speaker. So Mark, I will hand it over to you.
Thanks, Marissa, and good morning to everybody. I would say that at least from the Idaho Division of Veteran Services perspective, I think the biggest thing that's coming is we expect any day to get notified by the federal VA that we will get awarded a grant to start construction of the new Boise Veterans Home, which will actually get constructed around the existing Veterans Home right here next to the Boise VA campus. We expect that construction to start about this time next year and to take about 2.5 to 3 years for us to actually complete. The new facility is going to be, again, state of the art, single bed, single bath, residential areas for all of our veterans. It'll be a 4-story tall building because we don't have a whole lot of space over here, so we're actually building up. But with that said, it's a beautiful building. Super excited about that. And we expect that to happen over the next 3 years or so. So it does look like it is time for us to start. And as Marissa said, we have a very, very full schedule. Today's agenda is basically all things VA. Which is great because I think there's a lot of lack of knowledge of the different programs that the VA offers. And what I'll say really quickly before I introduce our first speaker is, here in Idaho, we are serviced by a number of different VAs. So we have the Spokane VA, we have the Walla Walla VA. If you're in Eastern Idaho, you're getting serviced by Salt Lake City VA. But here in the Treasure Valley, we have the Boise VA MC. And I will say that regardless of what you have heard about the VA or maybe what some of your experiences have been in other areas, we are extremely lucky. The Boise VA MC just goes above and beyond to help take care of the veterans. And not only that, they really put like working with veteran organizations at the forefront of what they do to make sure that they are providing the services that our veterans need here in Idaho, specifically in the Treasure Valley. I know that our relationship with the Boise VA has been phenomenal. They have helped us out in so many ways. During the COVID pandemic, They actually sent nurses over to our Boise Veterans Home to help out and take care of our veterans there when we had an outbreak. They've provided testing, they provided supplies, and that's just a few examples of the stuff that they've had. So we're really lucky today to have a lot of the leadership from the Boise VA on the call today to talk to us about the different things that they do. And it's my honor to introduce Director Dave Wood, who is the director for the Boise VAMC. And he's going to talk a little bit about the overview of the Boise VA here. And then he's got a bunch of his leadership team that'll talk about the specific programs that they have there. So without further ado, I would like to introduce Director David Wood.
Good morning. Thank you, Mark. I concur. I really appreciate the support we receive from the state and from you and your office and all of your staff that work for you and for the state. I want to share my screen and kind of start with high level the VHA priorities. And so let me do that. Okay, tell me if you can see my screen.
Yes, we can see it.
Okay, so these are VHA's 6 priorities, and that basically that means all of the medical center. These are the 6 things that we are focusing on. And so I want to just very quickly go through them and then touch on a couple of other things that are hot here at the Boise VA. One of the things is to hire faster and more competitively. And so we've been working with our HR nationally and here within our network and here locally to try and make it easier to onboard staff, to attract staff, to keep the staff that we have, and so that we can better serve veterans. The second one is access to care. And as you know, probably the biggest challenge that we have here at the Boise VA is growth and keeping up with that growth. That's why it's important for us to hire and keep staff in place, but also to really kind of focus on that second priority, which is providing access to services. Not only access to services here, but if there are services that we don't provide or veterans are too far away from us, to provide those services in the community. The third one, and probably all of you are familiar with the PACT Act, and it really focuses on environmental exposures is one of the key. There are many things in there, but that's one of the key things. And so we have been screening veterans. We'll continue to screen veterans, doing lots of exams for veterans, and trying to serve those veterans and respond to that expanded eligibility. There are many service connections now that are presumptive, meaning that if they were in a certain place, they basically can receive that service-connected disability, or if they have a certain condition, I should say, then they can, and we're in a certain place, can have that service connection. The next one is high reliability and really becoming a highly reliable organization. Most of the time you think of high reliability when you think of the airline industry, the nuclear power industry, because they're high risk but low fatalities. Healthcare is not really that kind of an environment. There are lots of things that happen in hospitals, but that is what we are aspiring to, trying to do everything we can, training our staff, having team huddles, focusing on process improvement and patient safety to try and become the safest organization that we can. And then the next one is whole health. really supporting not just the medical care needs, but also just the healthcare needs of veterans in general, helping them and meeting them where they're at, whether it's fitness, whether it's eating right, whether it's meditation, whatever, trying to add programs that will take care of the whole veteran instead of just their acute problems here at the hospital. And then the last one is preventing suicide. Nationally and here at the VA, we have quite a focus on that, trying to stem the tide of suicide of our veterans, and certainly have a desire and want to work with our community partners to work on that initiative. So those are the priorities. Let me stop sharing my screen now. I can figure out how to do that. Okay, and just a couple of things that I want to talk to you about that are going on at the Boise VA. We have a Caldwell Clinic, and we are in the process of building a new Caldwell Clinic. It will be done in August, and so probably in the September timeframe, we will open that new clinic. It is about twice the size of the current clinic. We are also attempting to hang on to our current clinic and add some additional services out in Caldwell. I don't know if we'll be successful in that endeavor, but that's something that we are trying to do. We are starting just the very initial planning phases of building a new clinic in Twin Falls that will be significantly larger than the current clinic and expanding there. And then the last kind of thing that we've been working on here is we're trying to expand primary care. We have a couple of large projects that we'd like to get off the ground. We've had bids, they've come in a little high. So we're rebidding them, we're rescoping those projects. They're going to take a little longer to complete than we thought. But it's something that's important to us and important to really expand services to veterans. So I'm going to stop there and just ask if there are any questions, specific questions about the Boise VA. I'd be happy to answer them. If this, I know we're crunched with schedule, so let me just, if you want to send me a message, I'd be happy to respond to any questions. And my email is david.wood@va.gov. Or you could call me and I'd be happy to respond to questions. The number here is 422-1100. And so that can get a call to me as well. So any questions, or if you want to put them in a chat, I'd be happy to respond that way as well. All right, thank you, Mark. I guess, or Marissa, I'll turn it back over to either one of you.
Thank you so much. That was a lot of good information. And yes, we do have a lot to get through today because the VA does a lot over there. So the next we have is Kathy Mallon from the Boise Regional Office. Are you on, Kathy?
I am. Good morning.
Good morning. Would you like to share with us about what's going on over there?
I would. So I would like to echo the fact that we do have a great working relationship with all of our partners here, and having worked in a lot of different places, Team Boise and Team Idaho is most definitely the best. I heard Mr. Wood saying that they were doing a lot of hiring and working on speed to hire. We too are doing a ton of hiring over at the regional office. So if you or someone you know is looking for a position, please check USA Jobs. They're all listed on USA Jobs. Some of them are ongoing. So yes, we are growing by leaps and bounds over here at the regional office. I also heard some of the discussion before the meeting officially started about benefits being the #1 search through your platform and through the various platforms. So I'd like to yield my time over to the Service Center to talk a little bit more about the PACT Act. We have already had 500,000 claims come through the system since the legislation was implemented. So I'm going to turn it over to the subject matter experts. Bill Mitchell, our Assistant Service Center Manager, followed by Kevin Schneider, our Service Center Manager. So take it away, Bill.
All right, thank you, Kathy. So I'm going to spend just a couple of minutes talking about the PACT Act and what it is. I can tell you, to us, the PACT Act is the single largest change that we have seen at VBA, certainly in my 15 years as part of the Boise Regional Office. It has had massive impact on us. The PACT Act, it stands for Promise to Address Comprehensive Toxins. Basically, the PACT Act has expanded healthcare and VA benefits eligibility to literally millions of veterans, as Kathy indicated, more than 500,000 claims already. The PACT Act was signed into law on August 10th, 2022. But it takes time, like any good legislation. It takes time for us to decode that legislation and turn it into policy and procedure for processing claims.
Keeping track of your steps.
So we started receiving claims. I think somebody's got a hot mic out there. If you could check your mics and mute them, that'd be great. Thanks. So we started receiving claims as soon as the legislation was signed into law, but it took us time to decode that legislation and begin to process claims. We started processing terminal PACT Act claims in January of 23, and we are now fully processing all PACT Act claims. When the legislation first came out, a lot of people thought, well, this is a Gulf War law. This is all about Gulf War, but it's not. The PACT Act legislation includes Vietnam era veterans and Gulf War veterans, post 9/11 veterans. It's really a large group. So the first thing that VA did as a whole, one of the first things, is we implemented what Mr. Wood referred to, and that was the toxic exposure screening. We first had to establish who was our client base. That toxic exposure screening is available through the hospital. You can find out more information about it at va.gov/PACT. And it's just a great opportunity for veterans to participate in helping us really determine what the impact of toxic exposure is. Excuse me. So, like any good government agency, one of the first things we had to do was create a new acronym. There is a very old concept that has existed for a long time, but now it has a name, and the name is TERA, T-E-R-A. That's Toxic Exposure Risk Activity. That's any veteran that served in a place where they were exposed to some type of toxin. For every claim that comes in, that's our first step, is to screen for toxic exposure risk activity. We look at the veteran's application, the veteran's service locations, any lay statements, any buddy statements, anything that they provided. Excuse me, I hope I'm muting my mic when I'm clearing my throat. Anything that the veteran has provided to place them at a place at a time where they could have been exposed to toxins. For herbicide exposure, one of the big things that occurred is it greatly expanded the locations where exposure to herbicide could have occurred. So we added Thailand at any U.S. or Royal Thai base. We added Cambodia, Guam, American Samoa, Johnson Atoll, lots of locations that allowed us to just grant presumptive service connection based on service at that location. We added additional presumptives. One big one was hypertension. We added that as a presumptive condition, which has been a contention for veterans, for Vietnam era veterans, for a very long time. So we were very pleased to see that. Another thing that the PACT Act legislation did was for presumptive conditions for herbicide exposure in the past. We required that the law required that it had to be the illness had to manifest itself within a specific amount of time at a specific compensable rate. Well, they've done away with all that. It just has to exist at any time at any compensable rate. So we're pretty thrilled about that. For our Gulf War and post 9/11 era veterans, We added burn pit and other toxic exposures. Lots of presumptives were added, a number of cancers, lung conditions, bronchitis, COPD, emphysema, asthma was a big one, sinusitis, chronic rhinitis, lots of different conditions that we added based on just exposure to burn pits. Radiation claims. We also expanded locations for presumptive service connection for radiation. Radiation claims are still centralized at the Jacksonville RO, which is a good thing because they're very specialized claim types to determine exposure. But we did add locations like the Anituak Atoll in 1977 and Palmarolas, Spain in 1966 and 1967, that where we can just grant presumptive service connection. All we need to be able to do is identify that the veteran served in that place at that time and now has a diagnosed disability. So we're very excited as a whole about this new legislation, and we're so excited about how we can really expand healthcare and compensation for veterans under this program. And Kevin Schneider, my boss, our service center manager, is going to spend a few minutes talking about the specific claim impact and how that's impacted us directly at the Boise RO. So, Mr. Schneider.
All right. Thanks, Bill. Good morning, everybody. Yeah, so we have been in a full mode of go with PACT. Nationally speaking, we started processing the work on January the 1st of this year. There was a few stations. We were fortunate to be part of this pilot group in December, where we were able to identify terminal cases across the country and process terminal cases for different presumptive conditions. So our staff really liked being at the forefront of that and being able to service veterans that were essentially needed the help the most at that time. So so if you're not familiar with how VBA processes claims, we have 56 different regional offices across the country. We're one of them, who we receive work on a national distribution level. And there's a lot of different algorithms and methodology about what case goes to which site and when. So I won't bore you with all of those details, but I thought I'd just kind of speak to a little bit of overview of the pact and where the country and VBA, where we stand in relation to where Idaho veterans, how many pending claims we have for Idaho veterans currently. So, but on the national scale, we currently have about 350,000 cases pending just for PACT cases. That represents about almost 50% of our overall inventory right now. We're right around 800,000 pending claims across the country. But for PACT specific, um, yeah, there's 350,000 pending. We've completed 275,000. And a little, I always like to consider what's the impact for veterans across the country. Well, as of right now, there's $1.1 billion in retroactive benefits that have been paid out to veterans across the country. So we're pretty pleased to see that we're meeting the needs there. So a lot of effort, as Bill described. There's a lot of technical process that our processors have to go through to concede exposure. But if you're curious about, well, of the 250,000, what does that mean for Idaho and Idaho veterans? So as of right now, we have about 1,900 pending claims for Idaho veterans across the states. We've completed about 1,600 in terms of grants. Overall, for Idaho veterans, there's about an 85% grant rate for claimed conditions. And the largest, or I shouldn't say the largest, but the most claimed condition that we have that we're seeing from Idaho veterans is hypertension or high blood pressure. And so that's stemming from that Vietnam veteran group where we've expanded presumption to Thailand, as Bill described, in Vietnam and blue water processing. So so we've got a lot of work here in Boise and across the country.
Responsible for opening it. If I'm not here, no one else is here.
Paul, I think you got a hot mic, so
Sorry
but
about that.
that's okay. So that's all I had to speak to. We're so fortunate. We've got a great relationship with our what we call our service organizations, IDVS and DAV. They're really at the tip of the spear in terms of their engagement with veterans, and we're always talking about if there's an urgent need, maybe a local veteran's in a financial strait or homeless or terminal. We're very keen to that. So appreciate the time, Marissa, and I'll turn it back to you.
Hey, Marissa, could I ask a quick question of Kevin? If a veteran is having trouble getting his claim processed, and well, it's been processed but denied, and he needs to appeal because the condition he has, it's hard to tie everything in, and he's doing all of this medical stuff with his doctor to get everything tied in. Who's the best person to refer him to really do in-depth processing?
Yeah, Sharon, it's a good question. I would always refer people to their what we call our service organizations. They're very knowledgeable on PACT, and they're very keen to what VA needs in terms of evidence, and maybe it's a specialized medical opinion from a specialist or not. So they're very comfortable in that space, and they can look at all of our records that we have in our database and our systems, and they can kind of drive what evidence is needed. So I would always refer back to the service organizations for that.
Yeah, our service officers here at IDVS specialize in that, so they can
Yeah.
absolutely help that veteran through that process. With the understanding that it still takes time. I mean, there's, depending on the situation, depending on the documentation that's needed, it still will take time. But our service officers have done that thousands of times, if not a million times, with many, many veterans. So please have them visit one of our service officers.
Thank
We
you.
have one more question. Nicole, did you have something?
I do, and it's related to the PACT Act. We have great relationships with the IDVS, and so I'm Nicole Watkins. I'm a social worker over at the Boise VA Medical Center, and I'm also the toxic exposure screening navigator for the VA. We have great relationships with IDVS. We're getting there with DAV as well, but I just wanted to tag on to what Mr. Wood spoke about, and Bill Mitchell, my former first sergeant, have to say. Big shout out to that guy. Hi. Anyway, the VA is, when we talk about screening, I think it's really important to know that the screening questions are very brief. It's not a full exam. There's no indication that a full exam is indicated when someone simply talks about their exposure. So the screening consists of, were you exposed to any toxins while you were in the military? And do you have any related health questions? Our providers are starting to learn about exposure-informed care so we can start caring for those veterans. But the idea that a full exam is required or going to happen based on that exposure is not the case. And additionally, the exams that are done with the registry does not mean register. So there is no, when you hear about Agent Orange registry or the burn pit registry, please understand that those are not required to be service connected or to receive your medical care at the VA hospital. So those are just two important things. And we have screened over 16,000 veterans so far at the Boise VA. So we're super proud of that as well. So I just had to plug that. So thank you.
No, that's wonderful. And yes, that's actually something that we get a lot of questions about. So I really appreciate, our veteran service officers and all these organizations working together. It's almost like we're joining forces to make sure that we take care of veterans. It's so strange.
Yes, love it.
Thank you so much. Next we have Josh Bode from Behavioral Health. He's the program manager over there. Do we have you here, Josh?
Yeah, good morning.
I'll hand it over to you.
Yeah, so I am the outpatient general mental health manager here at the VA Medical Center, which we call BHIP, which is Behavioral Health Interdisciplinary Program. So we provide more of the long-term mental health needs that veterans have. Veterans initially filter through what we call integrated care or primary care mental health. And then they're referred to us if their needs are more than 2 to 6 visits within that clinic. So we're providing case management, care coordination, individual therapy, group therapy. The VA as a whole is switching to a care coordination model. So we're about 3 years ahead of that. We did that shortly before COVID back in 2020. And we have 4 care coordinators. Each veteran who comes into our services is assigned a care coordinator who is their point of contact for all things mental health. They can call that care coordinator to access groups, individual therapy, have their case management needs met. Right now, currently, we have 9 social workers and 5 psychologists that are providing therapy and care coordination services here in Boise. We have 3 social workers at the Twin Falls Community-Based Outpatient Clinic, 1 in Mountain Home, and there's a social worker and a psychologist who do the BHIP type care over in Caldwell at that community-based outpatient clinic. What kind of questions do you have about accessing mental health care? One of the big changes we just made was we had separate intake processes for our substance use program, our mental health program, and our PTSD program. We all now share the same intake, so veterans aren't getting kicked around from one program to the other. They can do one intake and then move fluidly across those 3 programs without having to do another intake assessment, which is helpful for the veteran. What kind of questions do people have about general mental health in the VA? I guess I did a pretty good job this morning. If no one has any questions, my contact information is joshua.bode@va.gov. And you can reach behavioral health by calling 208-422-1108. That's the main line for behavioral health. If you have a veteran who needs to get set up with care, send me an email, give us a call. Happy to help them connect to services. We're always looking for creative ways to connect the veterans to services quicker. I know the worst thing is waiting for an appointment, especially when you have an immediate mental health need. So we have some services as well, such as same-day access and our behavioral health acute care clinic that can address those immediate needs while a veteran waits for an intake assessment. So if you have any questions, send me an email, give me a call.
Perfect. Thank you. Yeah, and we had one question. And it was about if someone needs help that day. So it sounds like you answered it.
All right.
So thank you so much. Next, we have Christina Pollock with the Boise Vet Center. And honestly, as I'm a veteran myself and I've gone through this process, and I know sometimes it can be a long process between filing for your benefits and getting approved and then actually getting into the doctor. And the vet center has been amazing as far as stepping in and kind of filling in some of those areas as well. That's at least the process I went through. So we're thankful to have you here.
Thank
And this
you.
is
It's
Christina
nice to be
Pollock, the
here.
director over there. Yeah. So I'll hand it over to you.
So, hi, I'm Christina. I'm from the Vet Center. I am the Vet Center director. I took over for Terry about 4 years ago now, which seems a million years ago, but that's okay. I'm also a veteran, deployed a couple times, so I've walked in some of the shoes. So yeah, Vet Center wise, I know you guys all know Dan and the big rig that goes all over the place that we have on the road now. So, which is getting a facelift. It's going to be blue. So I don't know. It wasn't up to me, but it'll be pretty. I'm hopeful. Um, it's going to have a whole new wrap, whole new branding because we like change. So I just wanted to talk about, so the Vet Center team has changed a lot. We are one of the bigger vet centers in the actual country, which is kind of surprising. There's only 9 of us. We have 6 clinicians.
7 of us are, well, there's 9 of us, 7 of us are veterans, 5 of us deployed. And then we do a lot of therapy. We do a lot of focus therapy. We do a lot of trauma. We have had a lot of success in our evidence-based practices. So we have 4 clinicians who are EMDR, we have DBT, we have all kinds of things. We did have a minor staffing setback. One of our clinicians is deployed. He's getting deployed on, I think, Monday, so he's on leave right now. So the crunch is real. So if there's any extra FTEs over there, just I'll take 1 or 2. It's fine. So two of the big points is we've got community access points in Twin Falls now. Cassidy goes out to Twin Falls once a month. And then we also have an access point in Caldwell at the Caldwell Memorial Hall, and Mark is out there once a week. We are hoping to hire another clinician. He will likely be in Caldwell another day a week and maybe Twin once a month as well. So we're trying to spread out the wealth. But we do a lot of EVC for veterans all over the state, honestly, and Oregon and a little bit in Nevada. Yeah, so again, a lot of counseling, a lot of therapy, families, spouses, the veteran or active duty service member. We do have a certain eligibility. I'll throw it in the chat because it's changing I feel like every couple months. So we just throw it in the chat. And then if you guys have any questions, let us know. One of the things, we are developing a pretty decent group list now. And we recently got additional funding through a donated partner with Vet Centers, and they are going to help us fund a bowling group over at Westies so that it would be free for veterans. It hasn't hit our account yet, but it's coming. And then also a art group. So they're going to fund all of the things, and we're really excited about that. They gave us a pretty decent amount of funding for that. We have a significant others group that is running, and then we also have 2 lady specific groups. So it's a closed cohort just for lady veterans or active duty members. That's really important because some of the co-ed groups don't work as well. And then we have a group specifically for folks with MST. And we are starting our male cohort in a couple months. So we're trying to get to everybody. I think one of the things when people talk about therapy is, and I hear this all the time, we'll have somebody come in and say, like, they met a counselor one time and it didn't work. They didn't understand me, so I never went back. And I think it's really important when you're talking to veterans and people looking for therapy is that not every therapist is going to fit with every person. So it's okay to shop a little bit. And I mean that not in a used car salesman way, but in like, it's like dating a little bit. When you're meeting with a therapist and it doesn't make sense, find somebody else. It's okay. Nicole, yes, it is so freaking important. And it's not the clinician's fault and it's not the person coming in for help's fault. It just is. It's just how it works. So I really encourage folks to talk about that with people that they're encouraging to come to therapy is shop a little bit, find the person that fits. And then also as a person goes through the world and through their lifetime, the clinician they had 3 or 4 years ago may not be a good clinician for them now. There's just a lot of caveats to this. So please, when somebody's looking for therapy, adjust and know that the one experience they had is not the experience they're supposed to have continually. I think we got to put a little bit of onus on the client and to do the work. The other thing I would say about therapy is that not all talk therapy is created equal. And for mental health, we have to be able to do a couple different things. So that's why I love all the community partners and providers. We refer all the time to all kinds of different providers. Like if it's a get outside kind of thing, if it's a community thing, we use our partners a lot because mental health is a broad holistic approach. So just on my soapbox, not all sizes fit the same. So just for therapy wise, but yeah, for Vet Center, we're trucking along. And if you need me, I'll put all my stuff in the chat. And then I'll also add the website for the eligibilities. But if there's any questions, just email me. That's the easiest. And if you feel like a client or a veteran, active duty, whatever, doesn't feel like they're gonna fit with us, let us know anyway. Our job is to get people eligible and not to turn them away. And on the thing of the eligibility, because ours is changing a bit, it's not yet, but we will be providing bereavement services for families who lost somebody by suicide. So that's a big, that's going to be a big eligibility to hold, but I think it's really important. So we're working on kind of how to fill that eligibility, but those families need help too and support. So I know there's other organizations doing it too. So we'll all work together. But yeah, I'm Christina. That's the Vet Center, and it's good to see everybody.
Thank you so much. We do have a minute. Is there any questions for Christina? No. I do have to say, going through this process, there are parts that take some time, but I was really impressed with how well the VA worked with IDVS and how well they worked with the vet center and how being at the vet center was an easy continuation going on to the VA. So any veteran you find that's struggling with this process, remind them to not give up and to trust the process. It may take time, but it is worth it. And there are amazing resources out there. And back to the behavioral health program. In fact, they have a written exposure therapy group. So going to that, not all sizes fit. If talking is too hard, there are other options. Start with writing, and it's pretty amazing what that can do and what parts of your brain it engages. So don't give up. Trust the process. So thank you, Christina. From outpatient recreational therapy, we have Ann Wildman. And I see you there. So I'm going to go ahead and hand it over to you.
Thank you. Good morning, everyone. I'm happy to be here and just share a little bit about our outpatient recreational therapy program. I primarily cover the telehealth needs, and my coworker, Christine Walsh, does more of the in-person outpatient recreational therapy. And I usually get the question of, what does a recreational therapist do? So I think I'll clarify that a little bit here. And a recreational therapist provides treatment to help maintain and treat the veteran's physical, mental, emotional well-being, and by helping to reduce their depression, stress, anxiety, recover basic motor functioning and reasoning abilities, build confidence, and socialize effectively. So a lot of what we do is try to get our veterans connected to each other, connected to their communities. So we're not only just in Boise, but I do the rural telehealth, which reaches Idaho and Eastern Oregon. So that's been something that's been added in the last couple of years just through that rural telehealth initiative. It was a grant initially, and the Boise VA absorbed those of us that were hired on as part of that grant. So a great addition to the VA as far as providing more services for our veterans. Some of the activities that we provide, of course, physical activities vary from our walking group, where we're trying to get veterans out, again, socializing, moving again, to more extreme activities like rock climbing. And then we have adaptive activities. We partner with the adaptive ski programs at both Bogus and Brundage. So we wrapped that up. Currently, we're piloting an aquatic therapy program at the downtown YMCA. We also do equine therapy. And then this month we have adaptive bike riding and archery coming up. And then, so those are more of the in-person opportunities as far as physical activities. And then For the telehealth options, I provide fitness groups and mindful movement groups that would include yoga, meditation, qigong, and these are offered not only as groups, but sometimes one-on-one, maybe if a veteran's dealing with a lot of social anxiety, or maybe it's a time constraint and they're only available certain specific time of the day. I do one-on-one sessions also. And then as far as creative type activities, we do craft activities over the telehealth, over the VVC, games like Boggle to help with social interaction, excuse me, and cognition. And then I recently just started a short story club. So, this is a brand new program. So I'm just trying things and seeing what works. So it's pretty exciting to be able to get creative and see what veterans are interested in. So with that short story club, the veterans had an option to either read that link that I emailed out to them, or I also sent out an audio link so they could listen or read the short story. So it's not a big commitment like it is to read a novel or an entire book. So I find the short stories are a little bit more manageable. And then I already talked a little bit about community reintegration, but that's a huge part of recreation therapy, is getting veterans, again, out of their homes, connecting back with their communities. So we help with finding volunteer activities that can help veterans, find meaning and purpose and become engaged again in their community. And that might be, volunteering at a community center, a library, or connecting them with those types of businesses in their community. So maybe getting them out and getting membership at a local gym, or joining the senior center and doing, some of the activities there. And then we also, some of our programs are offered at the Boise VA we're in building 23 down in the basement. We have an art studio there. But again, we do try to reintegrate into the community. So we use the Fort Boise Community Center quite a bit for activities. And that's where pickleball is. A lot of our activities, of course, are veteran driven. So we saw a need over the last, I think it was last summer, that there were a number of veterans that were interested in pickleball. So we saw the need, and fortunately, we have a great funding through the VA. I've worked at a number of other facilities and usually struggled with funding. But when we saw that need and had a number of veterans that were interested in pickleball, we were able to get the funding to purchase the equipment to get our veteran team going. So that has been very helpful, and another great reason that I so appreciate working at the VA. Let's see, what else? Oh, we have an art therapist that recently joined our program last summer. So as we were talking about other ways to work on mental health, if you're, kind of burnt out or have a hard time finding the correct words, or sometimes it's hard to put experiences into words. So that's where the art therapy can come in. And our art therapist uses creativity and self-expression to support mental health. And I think an important reminder with that is you don't need to be an artist to participate in art therapy. If you don't think you can draw or paint, it doesn't mean that you can't participate in art therapy. So don't let that hinder you from, trying something new. And as far as our programs, all of our programs are free to veterans. So that's another great way to explore a variety of interests and kind of see what resonates with you. And then probably the next question is going to be, how do you get involved with recreational therapy? And for a veteran to get involved with our program, they just need to receive or get a consult for recreational therapy, and that can be from their primary care physician. And then once that consult is placed, we'll reach out to the veteran and schedule that appointment with them. So that's just a little bit about recreational therapy. We have a lot more programs, but I don't think you want me talking for forever here, so I'll stop. But let's see, are there any questions from anybody? All is quiet. Well, thank you. I'll go ahead and put my information in the chat also, as far as my email. And the best number to reach me at is through the physical medicine and rehab. So I'll put that number in there too. All right, thank you. Have a great day.
Thank you so much. I honestly didn't know how much you guys did, so that is great to know. So I guess I should say, if people do want to contact you and be a part of this, will you put that information in the chat? Well, I guess they would need to get the recommendation, but will the organizations know directly how to contact you? Do you have that connection, or do we need to give them your specific information for that referral?
I think the veteran would be the person to get a hold of their primary care physician, and they'll be the ones that will need to request that.
And they'll know how to get a hold of you to make that request?
Yes, their primary care physician, yes, will know how to get a hold of us. Yeah.
Perfect. Thank you so much.
You're welcome.
That is wonderful things. And I think kind of speaking to where Mitzi is right now in Washington, D.C., with the Governor's Challenge, one of my favorite presenters when I was there last month was actually talking about how art really affected him and helped him move forward, and how that moved him into music. And that was his healing process. And again, everybody has a different path. Everybody has a different fit. And so it's really important we have all these resources available to us. So thank you so much. And with that, it goes right into our next presenter, Maritza Lorenzana. I'm so sorry. Maritza's a beautiful name. I know that name. From the Boise VAMC Suicide Prevention Program. Do we have you? There you are.
Yeah, thank you. Yep, it's Maritza Lorenzana, but I'm oftentimes just Marissa. So I hear that name a lot. It's
Thing, yeah.
interchangeable, I guess, for some folks. But thank you for having me. I am with the suicide prevention team. I'm a suicide prevention specialist. Currently, our team consists of our coordinator, suicide prevention coordinator. Her name is Kate, and she actually just started with the VA about a month or less than a month ago. So she's new to the VA and learning a lot. And then we have Victoria Thompson, who's also a specialist, myself. We have an open position on USA Jobs. So if you know a mental health provider, a clinical social worker who is interested in joining the suicide prevention team at the VA, I think the job posting is open for maybe the end of the week or maybe one more week. I'm not sure. And additionally, we have Travis on our team, and he is our community engagement. He's out in the community, out and about, doing a lot of, breaking down the barriers and making connections, not just with veterans, but the community as a whole. So with a lot of school district, faith-based organizations, just anywhere where a veteran goes, letting them know what services are available so that they could also kind of be the help that veteran get connected to the VA, and just providing a lot of information about what the VA provides in regards to mental health services. So a couple things that I wanted to discuss is that is the Compact Act very similar, sounds very similar to the PACT Act, but this is the Compact Act. And then also I just wanted to talk about the Veterans Crisis Line. So the Compact Act is a service to all veterans who may be experiencing, if they're experiencing a high suicidal crisis, if they go to the hospital, whether it's St. Luke's or St. Al's or any, or the VA, any hospital, if they're experiencing a suicidal crisis, we want them to get help. A lot of the time we hear that a barrier for a veteran to go and get help and accept help is the financial responsibility of receiving, a few $1,000 bill from St. Luke's or from a mental health hospital. So that's a barrier that's not just unique to Idaho, but across the nation. So the Compact Act came out January of this year. So if a veteran is having a suicidal crisis, we want to take that financial barrier away. And the VA is and will pay for up to 30 days of inpatient care. And then after they discharge from a hospital, and that includes that emergency department visit before maybe they're transferred to one of the mental health facilities. And then we will also cover 90 days of that outpatient mental health care. So we are hoping that by taking, removing that barrier for veterans, that they are, they feel more comfortable and willing to accept help. That also covers transportation. So if a veteran or a loved one feels that they need to call 911 and possibly come and have an ambulance pick them up and transport them to a hospital, it also covers that ambulance bill, which is very expensive as well. And it covers any outpatient medications that are associated with that admission or that emergency department visit. So we really encourage, want veterans and family members to know that they aren't stuck with this huge hospital bill. And also some veterans that come to the Boise VA, they do have co-payments as well. And some of those co-payments include admission to our unit. And so we want to take that co-payment away if they're accessing care through the Boise VA as well. So that is something brand new from this year that just started. And there's different ways, if a veteran goes to a community hospital, there's a number they can call, or a family member can call that number and let us know, let the Office of Community Care know that they were admitted. But we also have really great communication with our community hospitals, and a lot of the time St. Luke's and St. Al's, West Valley, they're sending us referrals and letting us know that veterans were admitted, and if we can help with follow-up, or if they could transfer to the VA hospital preferably. So we work very closely with our community partners, and we're out there trying to encourage and let folks know that, we want to collaborate and work together. We don't want to silo each other, right? So that's a little snippet of the Compact Act and a service that's now available to more veterans. And then I also wanted to talk about the Veterans Crisis Line. I hope that you all know that the new number for the crisis line is 988. So it's just a simple 3-digit number now. And if you're a veteran, you press 1. And once you have pressed 1, you get transferred to the Veterans Crisis Line. But 988 can be used by everyone nationwide. You don't have to be a veteran to call to use that number. So if anyone is needing somebody to talk to, experiencing thoughts of suicide, encouraging, any loved one to call 988. And if you're a veteran, you would press 1. And some folks wonder, what happens when a veteran calls 988, when they contact the Veterans Crisis Line. And we have been doing a lot of education of how if a veteran calls 988, it goes to a call center. The call centers aren't here in Idaho, but we get notified every time a veteran from our catchment area calls 988. And part of what our team does is that we outreach. We call that veteran within 24 business hours to follow up with them and ask, hey, you know, what's going on? We were notified that you called the Veterans Crisis Line. How could we connect you to services? Maybe they're already connected to services and they just needed to talk to someone. And so we encourage that too. I hear from veterans often that, well, I wasn't suicidal, so I didn't want to call the crisis line. And I tell them, you know, there's a reason why it's the veterans crisis line and not the veterans suicidal like crisis line. Everybody's crisis is different. And sometimes you just need someone to talk to at 3 o'clock in the morning, at 10 p.m. So we tell folks everybody's crisis is different, even if you're not suicidal, if you're having a lot of maybe depression, or you know, you just had a tough discussion with a family member and you need to maybe blow some steam on the phone, call the veterans crisis line. um, Not every crisis line, you know, is going to lead to a welfare check or police coming to check in on you. Sometimes you just need to talk to someone, and that's what they're there for. And so, as I mentioned, we get notified and we'll reach out to the veteran within 24 business hours and connect them to services, just check in with them, and just letting them know that we're available if needed. So that's a little bit about the Compact Act and the Veterans Crisis Line. Um, does anybody have any questions?
Well, thank you so much for sharing with us. This, and I believe it's Travis that's also on your team that is a part of
Travis.
the governor's.
Mhm.
Yeah,
Yes,
so
yes.
yeah, and you might see him out in the community again, engaging. I've seen him at the War Hawk. He went to the Governor's Challenge in Washington, D.C. And so he's been doing a great job in making those connections and really spreading that knowledge because there's a lot to know. Like
Mhm.
Mark said at the beginning of this call, the VA is doing a lot. And in fact, the Governor's Challenge is part of SAMHSA and the VA. So it's a whole effort to make sure that we're approaching this quickly, that we have appropriate resources that they can contact, but then also that continuation of care. What do they do after? So it's
Yeah.
just a great job, and I'm really happy to see all of this coming together. So thank you so much.
Yeah, of course. One other thing, because we have a lot of folks out that aren't from the VA out in the community, if we have a presentation that's called the SAVE presentation, and this presentation focuses on how to help somebody who's experiencing maybe a suicidal crisis, and the steps that you can take to be with them in the moment, and then encouraging them to get care or expediting care. So it's about an hour presentation. And if you have a group of folks that want us to go and meet you in person and do this presentation, we would be more than happy to do it. Suicide prevention, we know, just isn't just for veterans, it's for the community in general. So this could help a loved one. You never know who it can help. So if you if you could get 3 people together or 2 people together, like give us a call. We would be happy to do the presentation virtually or in person. So yeah, thank you.
Wonderful. Thank you so much. And yes, if you could get that information where who people could contact if they needed to set that up, that would be wonderful. And of course, as always, we'll send a lot of this information out as a follow-up to this joining forces meeting. So Mitzi will have a very busy schedule when she gets back from DC. um, Next, we have Sharon Cardona, the Women Veterans Program Manager. I actually got to meet with Sharon and sit down and talk about a little bit about what she does, and I was just blown away because we do have so many resources and changes as far as it goes for women being supported at the VA. And what I admired about Sharon was sure, we're doing all those things, but how are we telling women about these things? So she made a list and just started making phone calls of patients that she thought might benefit from this new information, and that's what we need in our veteran community. So I'll go ahead and hand it over to you, Sharon.
Oh, thank you very much. I know that time is short, but I have so much to share. I'm going to share my screen um, and just go through some of the slides that I've done in the past, and I'm going to skip some. But I am the Woman Veteran Program Manager for the VA, and this Directive 1330 nationwide was established to women veterans had been left behind in healthcare. And so nationally, we are trying to catch up so that we are equitable. We're receiving equitable care as men. By the way, I'm a veteran, 21 years in the Air Force as a nurse. So I retired. Anyway, my role is to ensure timely, equitable, high quality care, comprehensive healthcare services for women provided in a sensitive, safe environment at VAs nationwide. It is to support women veterans, and I am a conduit to the veterans patient aligned care team, which is called the PAC team. And when you enroll as a woman into the VA, you have a choice to request a designated women's health provider. And so we have women's health providers that are designated as for women, and they go through special training and have more continuous training on women's health topics. So when you enroll, ask for a women's health provider, and you'll get assigned. We have a separate building, the Women's Wellness Center, that women can go to. But we also have in the PACT in the main building and at all the levels of the C box, Caldwell, Salmon, Twin Falls, Mountain Home. We have designated women's health providers. So that's the biggest thing I want to convey is women have a choice, and they can, and all they need to do is ask. And again, just like as in mental health, if they get a provider and they don't click, then they can request a different provider. And so I'm also a source for issues and concerns. And I'm not going to go through every slide, so I'll be skipping some. But there is a Deborah Sampson Act that was established in 2019. And as the WVPM, I'm required to hold 2 town halls and 4 focus groups yearly. And the purpose of this is to address inequities and barriers that women veterans face. And the town halls, every veteran can join. We post it on socials such as Facebook, on our website, and we just try to get the word out when we're having a town hall. And I've gotten funding to have what's called BroadNet that does robocalls, and I provide a phone list of all women veterans. And this service robocalls all of the veterans, lets them know that we're having this town hall, and they can connect to it. The focus groups, I do cold calls basically, and I have to have a minimum of 3, a maximum of 9. And the Women's Health Medical Director and I, sometimes we invite others, other staff to participate. And we have focus questions, and we're trying to get feedback from the veterans in a small environment. Okay, so back to my role. Okay, so like I said, we have to have 1 to 2 designated women's health providers. We have a policy to end harassment and sexual assault. We want to improve access to and benefits for survivors of military sexual trauma. And we provide counseling programs for women veterans and their families. I have 4 overarching programs that I manage that I don't personally do the day-to-day work. But we have maternity care coordination, we have mammography care coordination, we have cervical cancer screening coordination, and for those that qualify, we have in vitro fertilization coordination. We do have women's healthcare providers for each of those programs that fall under the Women's Wellness Center. I also participate in outreach activities. I've gone to the Boise Vet Center with Travis a couple times. In next week, I'm going to the Oregon Women Veterans Conference. There's already 400 women that are registered, and that's we have Eastern Oregon CBOC, and so any Idaho veteran or Oregon veteran that is enrolled in ours can go to that, and we have a bunch of stuff going on with that. And I'm sure Marissa's going to talk a little bit more about the Idaho Women's Conference, but I want to let you know that for the Idaho Women Veterans Conference, we're going to have a table, the VA Medical Center. We're going to have somebody from eligibility enrollment, MST and IPV, LGBTQ+, suicide prevention, and M2VA, which is Nicole Watkins. So we're going to have a lot of representation at the Idaho Women Veterans Conference. And then I attend any events that could benefit women. So we have I'm not going to go through everything, but we have a lot to offer for maternity support. We did a lactation space work group, and now we have 4 or 5 specific spots in the medical center and women's wellness center where any veteran, visitor, or employee that needs to have lactation space, we have that available now, which we didn't have before I joined. Then mammography support, we're one of the best practice facilities. We've streamlined the process. We take care of the referral orders, the tracking of the results, provide a veteran notification, and we ensure that all of our veterans that need advanced breast care services have continuity in their care. This is what Marissa was talking about, prosthetic process. So any veteran that has a big lumpectomy or a mastectomy is authorized through the VA prosthetics. And this is all of the stuff that those women are qualified for. So if you ever hear of a woman that's had a mastectomy and doesn't have prosthetics or has questions, refer them to the Women's Wellness Center and we'll get them hooked up with this prosthetic process. We also have in vitro fertilization. There's 2 things I want to talk about here. VA Directive 1332 says that all veterans are eligible for fertility evaluation and treatment. If they need medications and they have a referral, the VA will pay for those very expensive medications. 1334 is for IVF. What that means is you have to have a service-connected condition that relates to your infertility. And it's a very complex process. And so that's why we have a coordinator that does that. It all starts at your provider. So just go to your provider and they will get you worked up for infertility. And then and then we will work to see if you qualify for IVF, which of course everyone knows is very, very expensive. And we cover those medications for both the spouse and the veteran. I have a Women Veterans Health Committee that I have once a quarter, and we have a woman veteran that's on the committee, and I won't go into details, but I just want you to let you know that we do that. We work with women veterans for the experience, and we monitor women veterans health care to make sure there's no disparity. Somebody talked a little bit about whole health, but whole health is a big deal now, and it's spreading, and we have a whole department devoted to whole health. So what we want to do is we want the veterans, male and female, when they come in, we want them to focus not on problems, but what matters to you the most, and take care of that. This actually is a trifold that we established, and and there is a link that you can go to, but whenever I go to any outreach activities. I bring those brochures. If I can't make it, Nicole, Travis, they have the brochures also available so that we can make sure that women know what services are available at the VA. And I do a lot of collaboration. Okay, the last thing I want to talk about is, I don't know how to stop sharing my screen, but is the Service Act. So let me just let you know just a little bit about the Service Act. Okay, here we go, and I can stop sharing. Okay, so the Service Act, so everybody's talking about different types of acts, but there is the Service Act that extends access to mammograms for all female veterans who served in areas with burn pits or other toxic exposures, regardless of their age, their symptoms, or their family history. And so if a woman wants to be screened for breast cancer, this Service Act, even if they're not enrolled in the VA healthcare, they can be screened. And so that's the message I want to say about the Service Act. And I think I'm probably out of time, but I wanted to make sure that I covered everything that I do. So if you have any questions, please let me know. We have a Facebook page, and I'm going to put that in the chat. So if you go onto Facebook, you can join the Boise VA, and we have a lot of socials that are posted all the time. So any questions? Okay, I will turn it back over to Marissa. Thank you.
Thank you so much. Yeah, there was a lot of information today, but I think a big takeaway is that's a good thing that we have so much going on and that there is this major effort, especially at our Boise VA, to take care of our veterans. Mark, did you have any closing words for us today?
No, just thank you for everybody for joining. Thank you for all our VA partners who came on and talked about their different programs. Really is a lot there. Sometimes it's hard to know about it, not hard to navigate it. So we'll make sure that as a follow-up, we get the minutes out for this meeting with all the contact information and a lot of the stuff that they shared, so that everybody has it kind of in their emails and they can help spread the word. So thank you everybody for joining.
Absolutely. Thank you, everyone. And again, that Women Veterans Conference that she was mentioning for the state of Idaho will be on June 11th, but we'll have more information coming out on that. And we will have a lot of those VA speakers. If you have a woman veteran who has more questions, please encourage her to come. So thank you all so much for joining us today. Have a good day.